is Laura, and today we're going to be going over some post-operative instructions after you've had an extraction. Following these instructions are going to help you minimize discomfort and help prevent any infection. You may have a gauze in place. If so, please make sure you keep this for the next 20 to 30 minutes. Second, if you do have a prescription that doctor did give you, please make sure that you do take it to your local pharmacy and take it as directed. You may still be a little bit numb. Please make sure when you're still numb to avoid drinking or eating anything. We are trying to prevent you hurting yourself while you're still numb. After a few hours, if you are still numb, please make sure that you do give us a call immediately. Sadly, I do have some bad news for my smoker patients. You do have to avoid smoking for the next 5 to 6 days, as this can prevent the healing process. Also, we want to avoid creating any type of suction. This is a great example for one. Smoking does cause this, and another great example is suctioning through a straw. Again, we want to avoid doing any type of suction motion. Now, I have a lot of patients that have the biggest questions, two big questions in regards to taking care of your mouth, brushing and rinsing. Yes, you are able still to take care of your mouth normally. What you want to avoid when brushing your teeth, avoid touching the area with any type of object. When it comes to rinsing, yes, you can rinse. Just please make sure you avoid vigorous rinsing in your mouth. What you want to do is take your mouthwash, tilt your head back and forth, and when you want to let it come out, just let it slowly come out. Do not spit out. After 48 hours, you are able to use any type of Listerine rinse. Another method of rinse you are able to use is salt warm water rinses, as this does also help prevent infection and keeping the area clean. Do not participate in any strenuous activities such as running, exercising, or heavy lifting, or picking your head up and down vigorously. We want to avoid any type of motion in your mouth to make that blood clot come out. In regards of eating, for the next few days, sadly, you cannot have any steak or those juicy, chewy meats that you love. You do have to be in a soft food diet for the next 2 to 3 days. This includes any soup, juice, water, tea, any of the sort, but please avoid drinking through a straw. When it comes to sleeping, try to keep your head elevated 30 to 45 degrees while you're sleeping. If there is bone graft placed on your extraction site or membrane, please avoid touching it. It is very normal to have gritty material. What is not normal is having that come out a large amount. If this happens, please call us immediately. Please also avoid touching the area. This includes with your tongue, with your toothbrush, or even stretching your cheek back to look at the area. Like we all say, out of sight, out of mind, right? In regards of your stitches, if you have them in place, please also make sure you avoid touching them. If they get so uncomfortable that you can't avoid touching them, you do have to make sure you give us a call, and we could try getting you in to make you feel more comfortable. Following all these simple instructions will help you heal properly and faster. But please do not hesitate to give us a call with any type of questions. Please keep in mind also, if you do have your extraction and you see that after a few hours you're still bleeding heavily, this includes your whole mouth covered, or you're just in tremendous amount of pain that not even your medication is helping, do not hesitate to call with any type of questions. Thank you.